everyone, Leslie Cornwell here, Midwifery Business Consultation. This section we're going to discuss hand hygiene for your midwifery practice, the importance of proper hygiene for healthcare providers. The objectives to learn the role of hand hygiene plays an important infection transmission prevention protocol, learn the right way and the right time to wash your hands, review the proper use of gloves to prevent germ transmission, learn to perform observational studies, figure out who is high risk, who is low risk, learn to evaluate your hand hygiene programs with your different organizations and different ways to improve hand hygiene. So evaluating each other, really focusing on when hand hygiene and protective equipment is most important. Hand and germ transmission, healthcare providers' hands, when not clean, are the main route of cross-transmission for potentially harmful germs between patients and our healthcare facilities. So we can make our own patients ourselves sick purely by not washing our hands well. Lack of hand hygiene and patient care increases risk. It makes you sick, it makes patients sick, especially when we're doing a home setting. We get a little more lax with our protective equipment, our gloves, our hand washing, our decreasing infection risk because we think home birth, normal healthy women, there are those rare times that the blood can have an infection in it that happened after the prenatal panel was occurred. So we just have to always protect ourselves and our hand hygiene prevents a lot of the infection transmission. There's another section you'll learn about with postpartum complications, and a good chunk of those, endometritis, of infection inside the uterus, and a lot of just generalized infections can be prevented by using aseptic technique and washing our hands really well. Increased compliance with hand hygiene means reduced number of patients and healthcare providers getting infections, decreasing our waste of resources and saving lives. Hand hygiene is really important to know the right way to do it in the right amount of time. The recommendations are a minimum of 20 to 30 seconds, and making sure you're doing lots of friction and rubbing of your hands, getting your cuticles, getting them between your fingers, getting higher chances of infection sites like rings, under your fingernails. Key terms: the patient zone area includes any patient surfaces, items that are temporarily or exclusively designated to that patient. The healthcare zone is more of the equipment we use, our space, all the services outside of the direct. So the example in a home birth setting, in a birth center, the bed, the nightstand, the birth stool, the equipment that the patient is regularly touching is the patient zone. And then any of the other surfaces where we do the newborn resuscitation, we set up our delivery supplies, the bathroom, we use all that stuff. The patient zone, patient X, it's the area surrounded, we already reiterated. So in the hospital setting, it'd be the bed rails, the bedside table, the sheets, the tubing, the medical equipment. So in a home setting, it's not as many things that you would think of, but the blankets that they're using, the pads underneath of them, any of the things that are close by to the patient zone is not always static. It can change, especially in a home birth setting or a birth center. The mom's ambulatory, she's walking around. The bathroom may become the patient-centered area, the birth stool, the bed, even walking outside. So you have to be fluid with what's defined as the patient zone. And then certain things, if you have a shared bathroom, you have wheelchairs in the hospital setting, different equipment that's being used. We have to be careful. We have to, before a birth, clean our equipment, wipe down things with medical grade wipes, put on our gloves, and then after delivery, make sure your instruments are getting sterilized appropriately. Our equipment is all getting wiped down, the things used frequently on the mother. So the Doppler, the gloves are all thrown away. We're using sterile gloves when appropriate for vaginal exams. The lubricant is single use versus multiple. There's just simple things we can do to decrease the risk of infection. Healthcare area, it's a little harder to find the healthcare area in an out-of-hospital setting. I would consider it more like the birth bags and all the things that we bring as equipment to the home or the birth center. So at a birth center, it'd be more of the fixed things that are surrounding the patient at that time. Hand hygiene is especially important to really make sure we're not touching a surface with our contaminated hand that someone else can touch later. So the right time to avoid prolonged hand contamination, it's really important to do more hand hygiene than not. Anytime you touch a doorknob, anytime you touch a surface that's got a higher chance, your cell phone, there's so many germs on cell phones. So we just really have to, when we use the bathroom, we want to eat, we do a procedure, we put on some gloves, pretty much most anything you can think of. You sneeze, you touch a surface where there's obvious blood and bodily fluids. So there's 5 moments for hand hygiene. We should be washing our hands before we touch a patient, before we touch a clean, sterile surface, or we're going to do a procedure. Anytime there's exposure to blood, bodily fluids, so especially in the birth world, the water broke, the baby just delivered, and it went out on your arm outside of where your glove was at. Blood, I mean, birth has a lot of bodily fluids. After we touch the patient, after we touch the patient's surroundings. So say there's a patient that just washed her hands, she touched a counter. Anytime we touch any surfaces, especially in a bathroom, we should just be washing our hands. 5 moments of hand hygiene. This is more of a hospital affiliated. So it's just reinforcing if there is a Foley bag, there's an IV pole, there's a bed rail, anything that's in that patient zone. So before touching a patient, wash your hand, because we do not want to make them sick. We do not want to, whatever surface we had touched beforehand, now, especially with a weakened immune system, pregnant women and newborns are immunocompromised. So we have to do extra good care to make sure we're not giving them any infections from ourselves. Maybe we just rubbed our nose and we have a bug brewing that we just don't know it. So we want to protect. And then we're protecting them from our hands passing on. And the procedures, anytime you're going to do anything. So I'm thinking more with birth, a procedure would be a vaginal exam. We're doing a repair, the birth itself. We want to keep things as clean and safe as possible. The tub should be drained frequently. If you have a birth center, you want to clean the tubs after delivery to the national standards with proper chemicals, because we don't want our birth tubs to become an infectious site that can be passed on from one mother to the next. So reiterating what I'm saying, our goal is not to, our skin has lots and lots of bacteria on it. So an example that's common in the hospital is a Foley catheter. We're reintroducing all this normal bacteria into the urethra up into the bladder. With a vaginal exam, every time you do a vaginal exam, whether you put on a sterile glove, we're reintroducing normal vaginal bacteria up inside the uterus that's not meant to be there. So it's not just about trying to prevent bacteria from going on one surface to another. It's keeping skin bacteria, keeping vaginal bacteria where it's supposed to be, and not reintroducing it into another area of the body that's not meant to have it. So fluid exposure, which is a very high chance in the birth world, no matter how well we try to be proactive, you could have a lot of fluid after it breaks, the water breaks, depending on the position the mom's delivering in, just from the placenta delivering, sometimes there's a lot of blood. So birth is a higher risk of exposure. So we want to be really careful that we're wearing the protective equipment appropriately. And you want to be protecting yourself from blood being exposed into your eyes and cuts, and we want to make sure that we are doing the same respect to our birth team. So anytime you touch a patient, you're just wanting to wash your hands because you don't know what bacteria infection. It's one of those things reinforcing wash your hand all the time. To protect yourself in the healthcare environment from harmful germs, it's not as much of a concern in a home or birth center setting, but in a hospital setting, the transporter could have just been on another unit in an isolation room. There's a lot higher chance of ventilation system. Hospital settings have a much higher concern of an infection transmission from patient to patient than a birth center home birth does. So looking around the surrounding, when it's a birth center, you have a standard of what you are cleaning the birth center before a birth, after a birth. When you're doing a home birth, you don't know the baseline of how clean a surface is. You can't see it. It's an invisible. Right now, it's very difficult to get a baseline of cleanliness from a home in this example. So you want to make an assumption, not that they're dirty people, that the surface hasn't been cleaned to the medical standard and you do not want to get them sick or another person you're taking care of next sick. So here's some more examples we just reinforcing. Just protect yourself and your healthcare from all the germs that are around us. Some germs are good and some are not good. So the right way to avoid prolonged hand contamination, use the appropriate technique, adequate quantity. So always carry in your birth bags, lots of gloves, hand sanitizer, soap. Don't make the assumption, especially doing a home birth, that all those equipment and things will be there for you to use. The longer a contamination is on your hand, the more chances you have of transmitting it to someone else or getting yourself sick. How do you wash your hands? It seems so simple, but we need reminders of it all the time. You want to be able to get the water nice and warm, get lots of soap, lather, lather, lather. It's more the friction and the rubbing than it is actually the soap that helps prevent infection. Minimum of 30 seconds. We teach second graders to sing songs, really getting in between your fingers, your knuckles, your rings, your fingertip. It's not recommended to have fake nails or longer nails just because you have a higher chance of getting bacteria underneath of them. And then preference would be to air dry them, but if you need to use a towel or paper towel, then what you have. And there's different ways of hand rubbing. This is more with hand sanitizer. Hand sanitizer works by the constant rubbing and then letting it dry. If your hands are still wet, it's not doing its purpose. You have to continue to dry and dry with the hand sanitizer to get the prevention of infection. So we already talked briefly, fingernails, artificial nails. You want to make sure that they're short, just because you, especially in high-risk areas, ICUs, immunocompromised women, even though fake nails do look nice, they just have a higher chance of breeding infection. Understanding medical gloves and proper use. Disposable gloves are used during a medical procedure, examination, sterile, non-sterile. Surgical gloves have a very specific thickness. They're sterile. A lot of times you'll double glove. So you want to decrease the chances of getting blood or bodily fluids on your skin. Gloves do not take the place of hand hygiene. Gloves, you neither alter or replace the performance of hand hygiene. So when you take a glove off, go wash your hands. It's reinforcing that 5 moments of hand hygiene. There are 2 major reasons for using gloves. The recommended main 2 reasons are reducing the risk of contaminating the worker themselves with blood and bodily fluids, and reducing the risk of germ transmission onto an environment and to other people. So your goal, your hands have a lot of germs and they tend to be the one place that puts it on everything else. Inappropriate use of gloves. Using a glove when it's not indicated is a waste of resources, does not decrease the cross transmission of germs, may result in a missed opportunity for hand hygiene, actually results in germ transmission. So if you keep your gloves on, the example I like to give is you take care of someone, get a little blood on your gloves and don't realize it, and now you're touching the handle, you're touching other things. As soon as you're done doing the procedure, you need to take the glove off. So the glove pyramid, when sterile gloves are indicated, so vaginal delivery, surgeries, anything invasive that has a higher risk of infection. Examination gloves are indicated in a clinical setting, direct patient care. Indirect patient care would be like handling bodily fluids like a urine specimen, cleaning up blood on the floor. If someone throws up, that's another reason to use your gloves. Gloves are not indicated when you're not doing, when you're doing simple things that aren't high exposure to blood and bodily fluids. So taking a temperature, blood pressure, giving an injection. I still would encourage you to wear gloves for that. Transporting a patient, using a telephone, making notes. These are everyday making a bed things that aren't directly needing gloves. Tips for improving hand hygiene compliance. Increase the availability of hand sanitizers. Implement the buddy system. So keeping an eye on each other and keeping each other accountable of washing your hands and making sure you're doing it the proper way. Have reminders near the sinks about the 5 minutes of hand hygiene and other reminders throughout your birth center or your equipment, like for charting. Summary: increase compliance with hand hygiene at the appropriate moments in the appropriate way will reduce the number of patients getting hospital-acquired infections, but the main thing we're focused on is out of hospital. We want to protect ourselves and we want to protect our women and families we take care of. Observational studies are key in determining the effectiveness. So watching each other wash your hands, making sure you're getting between your fingers, you're getting under your fingernails, you're doing it for a minimum of 30 seconds with frequent rubbing and friction involved. Here's the references if you need more information: the CDC and the World Health Organization. Thank you for doing this presentation.